In this video, I will share tips on how to protect yourself against coronavirus. So if you have friends, family, or even coworkers that still have questions about how to stay safe, I hope you'll share this video with them. A couple of things to keep in mind. COVID-19 has only been with us since November 2019, so safety recommendations continue to evolve. I hope you keep in mind that what we recommend today may change as our knowledge about COVID-19 grows. We are also influenced by information we gain from other countries, and as you know, each culture reacts differently to infectious diseases due to their different genetic constitutions. Also, these safety tips are not particularly unique to COVID-19 and can help protect us against other illnesses like the common cold, seasonal flu, and even pneumonia. So consider these as long-term strategies to help prevent those illnesses in the future as well. Various risk factors influence who is being most impacted by this virus. The most obvious factor is age. Unfortunately, the older population has the highest risk of fatalities. As an example, if an 80-year-old contracts COVID-19, their chance of dying from this disease is close to 15%, which is almost double that for a 70-year-old at 8%. As you can see, for those who are 30 or younger and COVID positive, their chances of this becoming fatal are less than 0.2%. Just be mindful that if you are older, you should be more proactive to incorporate the interventions I suggest in this video. Another factor on how we respond to viruses comes from our genetics. Some people are more predisposed to getting an infection. The good news is that our genes have to be activated by factors in our environment that are preventable. In this video, I'm not suggesting that I can change your age or your genes, but I will focus on factors that are within your control. So what are those factors? I divided them into 3 categories. Number 1, to strengthen your immune system. Number 2, prevent the virus from entering your body, and if you are ill, number 3, prevent the virus from infecting others who you care about. Now let's talk about category 1, strengthen your immune system. There are several ways to accomplish this. First, what you feed your brain. In other words, use knowledge to remove fear so that you have actionable steps to keep you and your family safe while avoiding the negativity that may come from over-consuming the news, as an example. The biggest fight may not be the COVID-19 pandemic, but the fear pandemic that it causes. Secondly, get enough sleep. I recommend 7 to 8 hours of restful sleep, and that should be enough for most of us. We want to avoid excessive stress. This may be an ideal time to learn about meditation or start listening to a motivational video every single day. Exercise. I recommend performing some sort of physical activity that gets your heart rate up at least 3 to 4 times a week. Be sure to allow plenty of time for recovery. Proper nutrition is important to ensure you are armed to fight any virus. There is evidence to suggest that the chronic inflammation caused by sugar and starch also increases the risk of complications that occur with COVID-19. Therefore, eating a lower carbohydrate diet where you reduce sugary and starchy foods should also be your goal. When you eat matters as well. Believe it or not, intermittent fasting can strengthen your immune system. There are no quality studies about fasting as it relates to COVID-19, but as a general rule, during fasting, your immune system may be slightly more vulnerable to viruses. However, when you replenish your body by eating, your immune system will get a boost with new immune cells due to a process called autophagy. So overall, the benefit is a stronger immune system. But keep in mind, While you are fighting an infection, is not the best time to fast. Check out my video in the description section below to review various types of fasting I've recommended to my patients over the years. Category 2, prevent the virus from entering your body. Viruses are spread two ways. First, direct contact, by being too close to someone who's sick via breath and cough, or second, indirectly by touching the same surfaces that were recently touched by an infected person. As Mom would always say, stop touching your face. Now more than ever, we need to break the hand-to-face connection. Habits are hard to break, but this one is a must. What Mom meant was to avoid the T-zone on your face, the eyes, the nose, and mouth. Since these mucous membranes are where the virus has the capacity to penetrate our bodies. This is in contrast to our skin, where our dead cells serve as a great barrier to protect us. Washing your hands is key. Wash your hands meticulously for 20 seconds or use alcohol-based hand sanitizer that contains at least 60% alcohol. So why 20 seconds? Well, it's because the coronavirus is covered with a lipid membrane that dissolves with soap. And just to be clear, soap literally breaks down the viral membrane, and research shows that it takes about 20 seconds for this to happen. And that's just about how long it takes to sing happy birthday. Soap also makes the surface of your skin slippery, allowing a portion of those germs to simply slide right off your hands. Also, keep your nails short if possible. Sorry ladies, hand sanitizer makes the membrane less stable and more permeable, so I suggest soap. And ironically, you'll find less fighting over soap in the store. I'm just saying. How we greet each other matters as well. I suggest selecting something with no contact. Handshakes have been changed to elbow bumps, foot taps to namaste. Avoid going to high-risk environments, such as an urgent care facility or clinic where sick people may be going. And that includes seeing me in clinic when it's not necessary. Most physicians like me have transitioned primarily to video visits, and if this is not possible, we use telephone visits. And if you must go to the clinic or hospital, please avoid bringing visitors, as most healthcare systems have very strict guidelines. The CDC recommendations have been evolving, but we now know that pre-symptomatic people can spread the disease. In fact, that may account for up to 25% of the cases. In other words, it's the people who we interact with and the public who are unaware they are positive who may be creating the greatest risk of spreading the virus. Surgical face masks were designed to keep you from infecting others, not you. There are plenty of gaps between the mask and face that would allow viral particles in the air to reach you. However, a mask does protect you from putting your hands in your mouth or touching your nose. The now famous N95 respirator masks worn by healthcare professionals are only worn during procedures like placing a breathing tube in a patient's mouth for a ventilator and must be personally fitted to ensure its maximal benefit. The public doesn't need N95 masks. Another nice option is a cloth mask. In fact, many have made their own at home. I recommend visiting the CDC's website for their recommendations on how to make your very own mask. Stay current on all your vaccinations. This is important not to delay. If you are due for a vaccination, make an appointment to see your doctor. And if you smoke, it's time to stop. Smoking regulates the receptors that allow the virus to bind to our cells. Higher mortality rates are seen in those who smoke. Category 3. If you are ill, prevent the virus from spreading to others in your life. If you are sick and have space in your home, use separate bathrooms, separate bedrooms, and always wear masks when interacting with family. Also, keep your distance, wash your hands before and after eating, don't share cups or utensils, and consider plastic or paper. Make sure to cover your coughs with tissue and discard immediately. In a pinch, cough in your elbow. By the way, that's why I'm no longer recommending elbow bumps for greetings. Sanitize your home like never before. Focus on frequently touched areas like tables, countertops, doorknobs, light switches, cabinet handles, keys, etc. Also keep in mind that coronavirus can stay on metals, glass, or plastic for up to 2 to 3 days. So what do you clean with? Most home cleaning products work just fine. Even hydrogen peroxide helps by reducing free radicals, which can rip apart viral outer membranes. Clorox works, but the fumes can irritate the lining of your respiratory tract, which is not ideal when fighting respiratory illness. It can also potentially damage the surface of metals and clothing. Soap or alcohol-based wipes are also an option. I hope you feel more prepared now that you know how to strengthen your immune system and keep the virus from entering your body as well as the ones around you. So I want to thank you for watching this video, but keep in mind that the content in this video is for informational purposes only and not considered medical advice. My hope was to provide some clarity related to the topic discussed. Please share with anyone you know who still has questions about the various ways to protect themselves from COVID-19, and don't forget to subscribe to my channel and hit the bell.